All right, so this is the cranial nerve lab activity. So you're going to want to fill out this chart. You're going to want to make sure that you have all 12 of the cranial nerves and know what their motor function is and their sensory function is. And you'll be using this chart throughout this video. Then I have some other common household items, like I have a couple of Q-tips, but you could use, just some tissue paper or, toilet paper, whatever. I have some something for the subject to taste, so I just have these chocolate chips that I'm going to be using, but you could use anything that you have in your household. And then I need something for him to smell, and so I've got here I have some peppermint extract, and then I have some isopropyl alcohol. But again, you can find anything in your household that you can use for those things. They just need something to taste and something to smell. So here he is, and we're going to start, okay, so we're going to start with cranial nerve 1, and we're going to work our way through. So cranial nerve 1 is the olfactory nerve. So I'm going to have him close his eyes, and then I want you to tell me, okay, so I'm going to have you take one of your hands and close one of your nostrils. And then tell me what it is that you smell. Can you smell that?
Peppermint.
Okay, and then close your other nostril. And can you smell that?
Mm-hmm.
Okay, good. All right, so the olfactory nerve has been screened and he can smell that. So the next nerve we have is cranial nerve 2. That's the optic nerve. So we're looking for vision with that. So we'll have him look straight ahead. And then I want you to tell me in the corner here, I'm going to have some fingers. So here, can you tell me how many fingers I have?
2.
Okay, and then how many fingers can you see?
1.
Okay, and then how many fingers can you see over here?
3.
Okay, and how many fingers can you see over here?
4.
Okay, so that's the optic nerve, cranial nerve 2. Now cranial nerve 3, 4, and 6 are they're the cranial nerves that move the eyeball. So I'm going to have him follow my finger with his eyes only. So I'm just looking to make sure that his eyes move along with my finger, which they do. So that's 3, 4, and 6. All right, so okay, so that's cranial nerves 3, 4, and 6. All right, so in addition, I want to test the oculomotor nerve by itself. The oculomotor nerve controls the smooth muscles of the pupil. So I'm going to take my phone and I'm just going to turn on the light here. I'm going to shine this in his eyes and I'm going to look for his pupils to constrict. You don't want to hold that on his eyes for very long. So we look for pupil constriction on one side and pupil constriction on the other side. All right, so that is cranial nerve 3. So not only does cranial nerve 3, which is oculomotor, move the eyeball, but it also controls pupil constriction. All right, and then we're going to go with cranial nerve 5, which is the trigeminal nerve. So cranial nerve 5 has both sensory and motor functions. The motor function is to control the muscles of mastication. So I'm going to ask him to bite down, and then I feel on both sides, and I'm feeling for his muscles in there to be nice and tight on the masseter muscle, which it is. Okay, you can relax. That's the motor portion. The sensory portion is sensation to the face. So I'm going to take my Q-tip and I'm just going to touch his face. Can you feel that?
Yes.
That?
Yes.
That?
Yes.
Okay, can you feel that?
Yes.
That?
Yes.
And that?
Yes.
Good. Okay, so that's the trigeminal nerve, both sensory and motor. So now we're on cranial nerve 7. Cranial nerve 7 is also both motor and sensory. So for motor, it controls the muscles of facial expression. So I want you to raise your eyebrows, okay? And then I want you to squint, okay? I want you to frown, smile. All right, so that's the motor portion. Now the sensory portion of the facial nerve is that it will bring information on taste back to the brain. So I'm going to have him, and it's only on the anterior 2/3 of the tongue. So I'm going to have him put this chocolate chip here on the front of his tongue and let me know if he can taste it. Mm-hmm. You can taste it. Okay, so he has taste on his anterior 2/3 of his tongue. So that's the facial nerve. So then we're on to cranial nerve 8. Cranial nerve 8 is the vestibulocochlear nerve. So it's for two things. It's sensory only, but it brings back sensory information on both hearing and balance. So first I'm just going to test his hearing, and I'm just going to rub my fingers by his ear. You can hear that?
Yeah.
And then on the other side, can you hear that?
Yes.
Okay, so he can hear that. So now I'm going to have him chest for balance. So I'm going to have you move your head over to the side, look all the way, turn your head all the way that way, and then look at me very quickly. Nope, I want your whole head to turn back towards me as fast as you can. There you go. And now we're looking for nystagmus in his eyes. Now I want you to turn that way, and then turn back towards me as fast as you can, and we're looking for nystagmus or imbalance. Okay, so that's cranial nerve 8. Cranial nerve 9 and 10, we kind of, we're going to look at this together. Cranial nerve 9 is the glossopharyngeal nerve. So this is taste to the posterior 1/3 of the tongue. So please put this on the back of your tongue. Tell me if you can taste that. Can you taste that? Keep sucking. Taste it now. Okay, so he's got taste to the posterior 1/3 of his tongue. So that's glossopharyngeal. And then also for both glossopharyngeal and vagus, they control the muscles of the throat. So I want you to swallow. And I can feel the muscles on both sides for the glossopharyngeal and the vagus nerve. The other thing with the vagus nerve is that I can feel his pulse. And so I can check for his pulse here. And then I want you to close your mouth and your nose, and I want you to bear down really hard, kind of like you're having a bowel movement. Just try to increase the pressure in your abdominal cavity. Okay, go ahead. Harder. Okay, and then you can feel his pulse really slow down there. So that's the vagus nerve. Okay, so that's cranial nerve 10. Cranial nerve 11 is the accessory nerve, so we're looking for the muscles of his trapezius and sternocleidomastoid. So I want you to shrug your shoulders, and I'm going to push down on both sides, and that's fine. Now I want you to look down like that, and I'm going to push up. Don't let me push up, and now turn your head this way, and I'm going to push up. Okay, so the accessory nerve is fine. And then finally the hypoglossal nerve, and that's where we're checking the tongue. So I'm going to have you stick your tongue out, and I'm looking to see if there's any deviation to the right or to the left, and there is not. So that's cranial nerve 12. Okay, so that's it for our cranial nerve activity.